an arrangement of the Prevention and Control Leading Group of the epidemic in Beijing, we are convening the press conference to take the questions as has been concerned by the general public. In June the 18th, the newly reported confirmed cases amounted to 25, with 2 suspect cases and 2 asymptomatic carriers. By the same time yesterday, the cumulative confirmed cases were reported to 603, with 411 in hospital and 411 discharged from hospital, 183 in hospital, and 9 death tolls. And there are still 15 asymptomatic carriers still under observation. Ever since the new outbreak of the Xinfadi wholesale market in Beijing, we have confirmed 183 new epidemic cases in Beijing. So the capital city Beijing is under severe conditions, and our prevention and control efforts are facing a lot of uncertainties. We must have quick discovery and precise control and effective treatment. We must curb the sources of spreading so that we could work on 2 fronts of prevention and handling. We must take effective measures to prevent the further transmission of this epidemic. The nucleic acid testing is one efficient way, so we must quickly act upon it to have wider coverage of the testing. All of those that should be tested must hold themselves to the testing points, and we must check the temperature, wear facial masks when we're taking the tests. We must also guarantee the orderly testing on sites to avoid cross-infection. We must also source the epidemic. For example, we must get to the close contacts so that everyone suspected to have been infected by the epidemic will be subjected to such inspection. And for the food-produced markets, restaurants, and cafeteria in the entities must be the key places of testing. For the communities, they must be closed off, and we have forbidden the outing of Beijing locals elsewhere. We must go all out to treat the positive cases by elevating the level of emergency response, and we must prepare sufficient materials. As to the community centers and healthcare centers, they must do their responsibilities with screening procedures and instant and immediate reporting. We must also guarantee the market supply by mobilizing the resources and stabilizing the prices, particularly the supermarkets, the convenience stores. We must guarantee that the vegetables will be supplied in efficiency and also with sufficient supply and stable price. Now, in this new wave of epidemic control and prevention, there are some false information about the epidemic. Some are rumors. Those rumors will severely influence the overall picture of our prevention and control efforts. The Public Security Bureau in Beijing has zero tolerance towards those behaviors. We will crack down upon those criminal behaviors of spreading the rumors or making the rumors and false information. We must stay alert about those rumors and do not spread them out, and coordinate with the Public Security Bureau so as to look at the big picture with our due contribution. Now, it's heat wave in summertime, so I still will encourage all of our common people to wear facial masks and do not go to the public places with a lot of clusters of people. And we must take a distance when we're out. We must coordinate with any sample taking and nucleic acid testing. We will have to safeguard our homeland with our common efforts. Today, we have invited Beijing Commerce Bureau, Changping People's Government, Beijing Center of Disease Control and Prevention, Ditan Hospital in Beijing, and some experts from the Health Commission to offer us updates about the epidemic and to take the hot issues and questions. Now, I would love to present to you the guests here with us. They are Deputy Director General of Beijing Public Security Bureau, Pan Xuhong, the Tier 2 Inspector of Beijing Commerce Bureau, Wang Hongcun, the Deputy District Head of Changping District People's Government, Wu Bing, the Deputy Director of Beijing Center of Disease Control and Prevention, Pang Xinghuo, the Deputy President of Ditan Hospital, Wu Guoan, and the director from the Microbiology Lab of China National Center for Food Safety Risk Assessment, Li Fengqing. Now, firstly, let's give the floor to Pang Xinghuo to brief us about the newly added cases and the situations of those typical cases. Good afternoon, ladies and gentlemen, dear media friends. Now, for the cases discovered yesterday, on June the 18th, in Beijing, the newly added confirmed cases here amounted to 25, including 17 male and 8 females. For their age groups, they averaged at 45 years old, with the minimum age 25 and the maximum age over 60, with 1 permanent resident in Beijing and 24 with their household registration elsewhere. 18 were in Fengtai District and 1 in Haidian District, 1 in Xicheng District. 7 are mild cases, 18 are moderate cases, and they already examined 21 cases have their contacts with Xinfadi wholesale market. 4 cases are still under our examination. So that's the situation about the cases. The case 1 is a male. It's a local from Shanxi province, and he lives in Huaxiang Fengtai district. His employer is Beishui Jiayuan in Xinfadi. It's a restaurant, actually. He actually got some infections since the 15th, and he was confirmed yesterday on the 18th. And case 2 was a 25-year-old Anhui person. He lives also in Huaxiang. He works in Beishui Jiayuan Mian Ju Dao noodle restaurant, and he got his infection on the 17th and was discovered on the 18th. He was also a mild case. Case 3 was a woman, a 43-year-old Anhui local, living now in Huaxiang and working also in the same noodle restaurant of Xinfadi wholesale market. He got her infection on the 15th and was confirmed in the 18th. Another one was also an Anhui woman living in Huaxiang and working in that noodle restaurant. She actually was discovered on the 17th and was confirmed on the 18th. It was also a general case. Another one was a Sichuan local, a male, living in Huaxiang, working in the same restaurant in Xinfadi wholesale market. And his symptoms started on the 14th and was confirmed on the 18th. And according to the clinical result, he was a general case. Case 6, Anhui male, a 49-year-old, living now in Huaxiang, working in that restaurant. He got his symptoms on the 17th and he was confirmed on the 18th. It's also a common case. Case 7, an Anhui male at 49 years old, living in Huaxiang Fengtai district, working in that noodle restaurant. He got his symptoms on the 18th and was confirmed on the same date. Case 8, a 24-year-old Anhui female local, and she lives in Huaxiang, works in that noodle restaurant. She got her symptoms on the 16th and was confirmed positive on the 18th, and she belongs to the mild case. So all the 8 cases are the employees of Mian Ju Dao restaurant. Among them, case 2 was actually a purchasing personnel in that noodle restaurant. The restaurant is right next to the seafood areas of Xinfadi Wholesale Market. So that's the noodle restaurant called 面面俱到. They regularly buy food produced from Xinfadi Wholesale Market, and since the noodle restaurant is located right next to the wholesale market, particularly the seafood area, so considering the epidemiology studies, we believe that it is related to this new cluster of infections in the Xinfadi wholesale market. For case 9, it's a 34-year-old Hebei male local. He lives in Gaomidian neighborhood of Daxing district. He works in a barbecue restaurant. According to him, he usually buys food from Xinfadi, and he got his symptoms on the 16th and was confirmed positive on the 18th. It's a common case. Case 10, male, 45 years old, a local from Hebei. He lives also in Gaomidian neighborhood. He works in Laoyang Tese barbecue restaurant. He is a service person, and he usually buys from Xinfadi. He got his symptoms on the 17th and was confirmed positive on the 18th. It's a common case as usual. Case 11, 53-year-old male from Hebei. He lives in Huaxiang Fengtai district. His employer is Xinfadi Wholesale Market. He got his symptoms on the 17th and was confirmed positive on the 18th. It's also a common case. Case 12, male, 24-year-old from Hebei province. He lives in Huaxiang Fengtai district. He works in Xinfadi Wholesale Market. He got his symptoms on the 17th and was confirmed on the 18th. It's a common case. Case 13, male, 53-year-old from Hebei province, lives in Huaxiang and works in Xinfadi Wholesale Market. Got his symptoms on the 17th and was confirmed on the 18th. Common case as well. Case 14, 45-year-old Fujian local, lives in Huaxiang and works in Xinfadi Wholesale Market. He got his symptoms on the 18th and was confirmed on the same date. A common case as well. Case 15, male, 51-year-old from Hebei province, lives in Huaxiang Fengtai district and works in Xinfadi Wholesale Market. He got his infection on the 14th and was confirmed on the 18th. He belongs to also the common case. Case 16, female, 27-year-old from Henan province, lives in Xinfengmeng Zhen and works in Xinfadi Wholesale Market. She was confirmed on the 18th, and it belongs to a common case as well. Case 17, 43-year-old male from Hebei province, lives in Huaxiang Fengtai district and works in Xinfadi Wholesale Market. He got his infections on the 16th and was confirmed on the 18th. Belonging to the mild case. Case 18, a 47-year-old Henan male, lives in Xinhongmen Zhen of Daxing district and works as a price quotation personnel in Xinfadi. He got his symptoms on the 17th and was confirmed on the 18th. It's a common case as well. Case 19, male, 69-year-old, a Jilin local, lives in Zhanlanlu neighborhood of Xicheng district, retired, and he previously bought things from the Xinfadi wholesale market, and he got his symptoms on the 14th and was confirmed on the 18th. Case 20, female, 55 years old, from Shandong province, lives in Qingyuan district of Daxing, and on June the 6th, bought things from Xinfadi, and on the 8th, got his symptoms, and on the 18th was confirmed as a normal case. Case 21, male, 27-year-old from Shandong, and he lives in Yongdinglu neighborhood of Haidian district. He works in a government agency, and on the 14th, in Yuquan Dong Market, he was a close contact. Got symptoms on the 18th and was confirmed on that date, belonging to a mild case. So that's about the cases. I have to tell our general public that this epidemic has very complicated sources of transmission, and we must stay alert and avoid outing or eating out or gather in public spaces. In your working space or in your neighborhood, you must have good ventilation to cut the risk of transmission. If you've ever visited Xinfadi Wholesale Market, you have to conform to the requirement of the neighborhood. You have to actively report and stay at home with protection. And in addition, in the sampling of Xinfadi Wholesale Market, the transaction lobby, particularly the areas selling the beans or aquatic food, there are a lot of positive cases. So that area is heavily polluted. I recommend our general people to properly handle the beans or the seafood bought previously from the wholesale market. We must also have very good habit of sanitation and be fully informed about the new cases. We have to shoulder our individual responsibility and conform to the requirements of Beijing City for epidemic control and prevention by executing the measures recommended. In recent days, according to the risk level, Beijing has been organizing certain personnel for nucleic acid testing, and they are taking the tests orderly. If you don't have some close contacts or some other reasons, you don't have to go to the site for testing. That's all for my report. Thank you, Madam Pang Xinhuo. Next, let's give the floor to the Deputy District Head of Changping, Wu Bing, to give us a brief introduction. Dear media friends, good afternoon. On June the 18th, from International Hospital of Peking University, there has been one reported confirmed case. On June the 14th, there was one case, and that person is actually a close contact. It's a nurse, and she has been working in the hospital. After reporting from Changping neighborhood, we have closed off that hospital. And as to the actual situation, firstly, we organized a panel. That panel of experts are stationed in the hospital for coordination, and they made the plans and execute the measures to cut the sources and channels of spreading. Second, treatment. For the confirmed cases, we sent them and referred them to the designated hospitals for immediate treatment. Third, cut off the transmission sources. For Peking University International Hospital, we segment the hospital into different zones with quick epidemiology, screening, and investigation. We enlarge our coverage of the nucleic acid testing, and we have studied the pathways of the epidemic and get in touch with all the close contacts. Fourth, elevating the protection level of the hospital. We have disinfected the hospital even on the weekends. For the emergency rooms, we have stopped services. We stopped admitting the new patients to reduce the density of population. Changping District has done epidemiology studies of the case, and we will keep sourcing the case to have instant discovery and testing and quarantine so that the infection will not be further spreaded. And we also offer services for the suspect or confirmed cases. We also have stringent neighborhood control and the perfect control of public spaces. There are 15 measures in total so that everyone will be held accountable. Thank you, Wu Bing. Next, from Ditan Hospital, Wu Guoan, to brief us about the newly added confirmed cases treatment situation. So, dear media friends, here I am to report to you the medical treatment of the confirmed cases. On June the 11th in Beijing, the Xinfadi Wholesale Market was the source place of this new wave of epidemic, and by the end of June the 18th, Ditan Hospital has received a number of 183 confirmed cases and 3 asymptomatic carriers, totaling 186, with 82 female, and the youngest is only 8-year-old, and the oldest is 70-year-old. there are 3 children cases, 2 dangerous cases, and 11 high-risk cases. So considering the features of Xinfadi wholesale market, our medical team fully considered the requirements of the Prevention and Control Leading Group and the National Health Commission. We gathered the expert resources to do our best to treat and rescue the cases. We combine the TCM with Western medicine, and also for the frontline workers like Tong Zhaohui, Jiang Li, Liu Qingquan, Du Bing, who used to be stationed in Wuhan, they come to the rescue right now. And secondly, for the municipal level expert panel, they will have a daily counseling and touring of the wards to offer customized treatment plans to the patients. There will be screening on a daily basis so as to instantly discover the changing of the situation of the patients, for example, turning from mild case to a severe case. Thirdly, mobilize our human resources. From 80 municipal level hospitals, we have actually attracted over 100 medical staffs, including 26 nurses, over 100 hospitals, 8 testing personnel, 6 radiology experts to support our rescue efforts, including 16 nurses with full experience of saving the highly risky patients. For example, Tong Zhaohui from Chaoyang Hospital and Jiang Li from Xuanwu Hospital. Those 2 have been sent to treat and care for the dangerous cases. They have played their role to the full by combining TCM with Western medicine. We mobilize the resources. For example, now for the severe cases, the parameters in our screening have showed a steady recovery. In the headquarters of Ditan Hospital, we have increased our beds and our capacity. The beds amounted to 1,070. We have gone all out to save and treat those confirmed cases. That's all on my part. Thank you. Thank you, Mr. Wu Guoan from Ditan Hospital. Next, let's invite Deputy Director General of Beijing Public Security Bureau, Pan Xuhong, to brief us about how to handle the rumors. Dear media friends, good afternoon. On June the 11th, the Xinfadi wholesale market has seen the outbreak of this epidemic, and the whole city has held high the banner of epidemic control and response. We worked around the clock to curb the further spreading of this epidemic, and we convened a press conference to brief the media about these updates and to respond to the concerns of the general public. However, some rumors are right now interfering with our prevention and control efforts. So Beijing Public Security Bureau pays attention to the rumors by examining the source of the rumors and cracking down upon them. For now, we have handled 60 such cases. We have actually hold 1 person in criminal case and 9 in the administrative cases. Now, I would love to share with you about 4 cases. Case 1, Tan Mouke. It's a male, 69-year-old. He made rumors about 8,300 Xinfadi tests. 5,800 are negative and 2,500 are positive, according to him. That's just nonsense. And he sent the information through WeChat to Mr. Wu, and then Wu further shared that rumor in different WeChat groups. Right now, those 2 people have been held in custody in Fengtai Public Security Bureau. Case 2, netizen Zhao, 31-year-old male, unemployed. Just to give vent to his hatred, He made rumors about over 400 people have died from this epidemic. Now, he has been held in custody in Fangshan Public Security Bureau. Case 3, Jiao Moutao, male, 35-year-old. He used to be a worker from an express company. Just to attract attention from the public, in his WeChat groups, he made rumors about his positive result of nucleic acid test, leading to a lot of bad influence. Now he has been held in custody in Haidian Public Security Bureau. Case 4. Female, Liu, 41-year-old, unemployed. Also to attract attention and to give vent to her emotions on the internet, he posted a lot of rumors. And for example, in the rumors, the government has never locked down Xinfadi wholesale market, and several thousand Beijing locals have died. Now, Madame Liu has been held in custody in Tongzhou Public Security Bureau. There has been no boundary on the internet, but for our communication, there should be some boundaries. We must not trust in those rumors and let alone spreading them out. That is our due responsibility as a citizen. We must safeguard the social order and serve the general picture of preventing and controlling the epidemic. We welcome all of you to report to us about those rumors, and our bureau will remain zero tolerant of those rumors and crack down heavily on those criminal behaviors. So, a reminder to the general public. Any information about Beijing's epidemic control and prevention, please refer to the Coronavirus Prevention and Control press conferences and some official websites. That's all. Thank you. Thank you, Mr. Pan Xuhong from Beijing Public Security Bureau. Next, from Beijing Commerce Bureau, Inspector Wang Hongcun to brief us about epidemic control guideline in the business sector. Dear media friends, good afternoon. The emergency response level has been elevated to level 2 from level 3. There are 9 stringent measures, and the Commerce Bureau has been strictly implementing the requirements of the leading group to guarantee that the business circle will conform to that campaign. We respond to the requirements in line with the actual situations of the business sector. We organize our efforts towards the supermarkets, wholesale market, transaction lobbies, the logistics, the expresses, the barber shops, restaurants, the home appliance maintenance, the filling stations. In total, we cover 13 industries in our guideline. And such a manual has been reviewed by the Center of Disease Control and Prevention, and it will be published in those days. So according to the requirement of precise and efficient control and prevention, we implement the measures of encouraging wearing facial masks, good ventilation, and social distancing. We have detailed the standards and requirements of epidemic control and prevention, particularly the management of the personnel health. We cover the parking lots underground, the elevators, and other public spaces in our disinfection measures so that the business players could play their role in epidemic control and prevention. In the catering business, we specify that there will be no gathering gala, for example, for wedding. And also, when we go out, we must have a distance between 2 persons with at least 1 meter's distance. In the supermarkets, we also identify that there should be temperature check and avoid gathering of people, and there must be good ventilation. The staff members, when they are receiving the customers, they must all wear facial masks. For the cashiers and other workers, they must wear gloves. When a case occurs, there must be instant response. In the express industry, the personnel, like the distributors and the express person, they must all have 1 meter distance from the customers. When they are working out, they must wear medical facial masks, and they must also show their QR code about their health status in Beijing. And there might be some new manners of express. For example, putting them on the shelves of the neighborhood to avoid direct contact with the clients. Beijing Commerce Bureau has its website, so if you want to know details, you could refer to it. We will work with the law execution department to manage the supermarkets, shopping malls, and restaurants. We will urge enterprises to shoulder their responsibilities in epidemic control and prevention. Thank you. Thank you, Mr. Wang Hongcun. Next, let's give the floor to Q&A from our media friends, and please identify yourself before you raise the questions.
您好，我想问一下林凤琴主任，就是食
My question is to Li Fengqin.
包装，那会不会携带新冠病毒？
For the food and food packaging, will they carry this virus and will they be the carriers?
是这样的。那么食品和食品包装材料呢，到目前为止，
For the food and food packages,
新冠病毒污染。
up until now, we believe that they might be polluted by the coronavirus.
说了检出来。
As Peng said,
在这个环境
we have examined coronavirus in that wholesale market environment. So any food or food packages stored in that environment, they might already be polluted. Thank you. Next question.
你好，新华社记者提问，我想继续
From
来问
news
一下李
agency.
主任，因为刚才说到这个
I
食品和
want
食
to
品包装有
take
可能
another
会被污染。
question to
那
Lee.
假如说这些
As
食
has
品
been
它
said, the
被
food
病
and
毒污
food
染了
packages might be
是
polluted.
在
Imagine that
哪
they are
些
already
环节
polluted
可能
by
会
the
发生这样的
virus.
情况？
Then
谢谢。
when did it happen in the process?
病毒污染的环节呢，那么也有很多。那么到
For the
目前来
pollution
说
of those
我们
packages
批发
and the
市场
food,
就是在这个批发市
there are a
场
lot of
环节
possible
那么销
channels.
售环
For
节
example, in the
都有可能发生
wholesale
这个污染。
process or the sales process, they might be polluted. As long as that whole environment has been polluted, then for any food and food packages stored in that environment, they might be polluted at any time. Last question, please.
谢谢主持人。北极青年报记者提问，想请问一下庞主
Thank
任
you. From
现在
Beijing
网
Youth
传有
Daily.
外省
My
人员
question is
支
to
援北京
Madam
防疫
Peng.
请问这是什么情
According
况
to
谢
some
谢
information, there are some other provinces supporting Beijing's efforts in epidemic control and prevention. Is that true? Thank you. To handle the cases, we have done epidemiology studies, so we coordinate with the other provinces to share our experience. And according to the arrangement of National Health Commission, the CDC requirement, and Jiangsu province, Shandong province, Henan province have also sent their CDC members. In total, 10 experts have actually now arrived in Beijing for such epidemiology study. This is a reflection of the high attention of National Health Commission towards this epidemic, and also the sister provinces have a strong bond with Beijing. They are working together in such coordinating efforts. So we will fight shoulder by shoulder. And this is the end of the Q&A session. The press conference is held by Beijing People's Government and Tianlong Network, Shoudu Zhichuang, Beijing Daily, Xinjing Newspaper, Beijing News Daily, Beijing Toutiao, FM, Beijing Times, People's Daily, Beijing.com, Renmin Video, News Agency, News agency Beijing TV and CCTV, the financial channel of CCTV, and China.com have been live broadcasting this press conference. Beijing Jiaotong Broadcasting and News Broadcasting have also been live showing this press conference at about 19 o'clock tonight. So this is the end of the